Now, before we begin our conversation on the second phase of COVID-19 vaccination, let's take this background report by Abdulsalam Jibril.
The world is still reeling from the effects of COVID-19 as it presented an unprecedented challenge to economies, public health, as well as people's livelihood. However, safe and effective vaccines have become a game-changing tool that has helped mitigate the spread of the virus. In Nigeria, after the first confirmed case of COVID-19 was announced in February 2020, the country began her vaccination drive in March of this year. With Cyprian Ngong, a senior registrar at the National Hospital, becoming the first person to receive the Oxford AstraZeneca vaccine, the National Primary Healthcare Development Agency says over 2.2 million people have been vaccinated with the first dose and over 1.1 million people vaccinated with the second dose of the Oxford AstraZeneca vaccine. As COVID-19 cases across the country continue to rise as a result of a third wave of the virus, experts harp on the need for more Nigerians to get vaccinated. Consequently, after taking delivery of over 4 million doses of Moderna vaccines from the United States and 177,600 Johnson & Johnson vaccines from the African Union, the federal government has commenced the second phase of vaccinations.
Officially flag off phase 2 COVID-19 vaccination in Nigeria.
Recall that the rollout was postponed from August 10th to August 16th because of administrative issues. While the Moderna vaccine comprises of 2 doses, the Johnson & Johnson vaccine is a single-dose vaccine which health experts say will be beneficial for rural areas and hard-to-reach places. As the country intensifies her efforts to battle the current third wave of infections, how will it consolidate on the successes and surmount the challenges recorded during the first phase of vaccinations?
Well, thank you indeed, Kunle, for that report. And of course, Abdulsalam rather for the report. And now let me introduce our guests for this discussion. Joining us here in Abuja to speak on the second phase of COVID-19 vaccination is the Executive Director and Chief Executive Officer, National Primary Healthcare Development Agency, Dr. Faisal Shuaib. Thank you, sir, for joining us this morning.
Thank you very much for having me. Good morning, viewers.
And also with us in Abuja studio is Dr. Harunam Shelia, Chairman, House Committee on COVID-19. He was a former Commissioner of Health in Borno State and consultant with the University of Maiduguri Teaching Hospital. You're welcome to the program.
Thank you very much, Kilian. Good morning, Nigerians.
All right, joining us via Zoom is the Director General, National Agency for Food and Drug Administration and Control, NAFDAC, Professor Mojishola Adeye. Thank you for joining us, Professor.
Thank you so much. It's good to be here. Always good to be here. And thank you, viewers.
You're welcome. Gentlemen and lady, we are in to, see how secured health-wise Nigerians would be as far as the COVID-19 is concerned. And there was some sort of apprehension at the beginning of this year when the Delta variant came on board and then started wreaking havoc all over the place. And even today, we're still having some development that are really negative. Numbers are rising, and then people are really becoming apprehensive. Unfortunately, people are not really taking the real precaution as required, as in the first phase. Dr. Shuaib, let's hear from you for a start. What's the situation at the moment?
So right now at the Presidential Steering Committee on COVID-19, the Federal Ministry of Health and the National Primary Healthcare Development Agency were all set to roll out the second phase of the COVID-19 vaccination program. Following the launch on Monday, we're now in the process of making sure that all the states have their vaccines, and then they will roll out subsequently. We're calling on all Nigerians to seize the opportunity to actually take the vaccines. And we're working round the clock with all of the media entities to make sure that people know where to go for their vaccines. People should be aware that these vaccines are safe and they are effective. So we're really excited, working with NAFDAC, especially in the last couple of days, just to make sure that not only has NAFDAC certified these vaccines as safe and effective, but also that we're able to track and trace. I'm sure my sister, the DG of NAFDAC, will speak more to the tracking and tracing that we did. But we're really, really proud of the work that we did following the first phase of the vaccination rollout. And this second phase will be an opportunity to reach additional numbers of Nigerians.
Well, of course, from all indications, the first phase of vaccination captured just about 2 million Nigerians out of over 200 million. That means we've just taken one step. Right now, what is the mechanism for determining the quantity of the doses given to each state?
So we look at the data. We've always been an organization that relies heavily on the evidence. So we look at the epidemiology of the virus, right? So in the first place, what the vaccine is supposed to do is to protect, the individual from severe disease, hospitalization, and death. So you need to look at the data and see what is the data telling you. Where is it in the country that you have the largest number of cases? Where are people most vulnerable, right? And from what we've seen in the course of this pandemic, it's been, Lagos, it's been the FCT, Kaduna, you've seen cases in rivers, but particularly with this particular wave, with the third wave, we've seen Akwa Ibom, bubbling up as one of the states that has increasing numbers. So in apportioning doses to states, we look at the epidemiology. Those states that have larger numbers are likely to get more doses of the vaccine. But having said that, we also look at other parameters, right? So in states where there's a high positivity rate, in states where, for example, there are larger, urban areas, where we also see that if people are not well protected, there's a huge vulnerability in terms of the possibility for an explosive outbreak. We'll also consider those sort of states for additional doses of the vaccine.
Haruna Mshele, you're the chairman House Committee on COVID-19. And I must really say congratulations really for having come this far. We are through with the first phase, and then we are now on to the second phase of vaccination against COVID-19. From inside the house to outside the house, across Nigeria, there have been, as we earlier said, there have been this spike in the infections of COVID-19, especially Delta variant. And the people have not been really taking it so serious, as we said, as in the first phase. I don't know, have you been looking at that from a legislative point of view as regards, looking at how Nigerians could be further desensitized and take the issue of, using the non-pharmaceutical measures or taking them seriously in order to guard and protect themselves against COVID-19. The first phase was really hectic. People were afraid, and there was that seriousness about it, but now it seems as if it's just there.
Well, thank you very much for that question. I would say that if there is one area that the government of this country worked as a unit, was in COVID-19 mitigation efforts. And if you think back, in fact, even before the president set up the presidential task force, the National Assembly was the first to, in fact, invite the key players in the health sector to come and interact and tell us what is going on, what do we need to do, what are you doing? And I think in the Speaker of the House of Representatives, Right Honorable Femi Bajabiamila, he is the most health-friendly speaker ever to have led that house in this country, because he's always on the front foot in trying to deal with health issues, and COVID-19 was not an exception. So having interacted with the key players, he went ahead to establish this committee, which I was privileged to head. And we had interactive sessions with key players like Dr. Faisal here and his other key stakeholders. And then we made sure we supported the executive in trying to see that the mitigation efforts yield results. And you know, if you remember when the COVID-19 came in, the budget had already been passed for 2020. So we said, okay, something needs to be done because there's nothing COVID in our budget. So they brought in a supplementary budget which we expeditiously treated and passed. And that was how we were able to make sure all the things they were able to do were properly funded. And we didn't just stop at just mitigating efforts, but we remember that because of the processes in trying to mitigate COVID-19, the economy was almost brought down to its knees. So we made sure that all key players in the economy were also taken care of through the Economic Sustainability Committee, which we make sure they were properly funded. And if you check the revised budget of 2020, you will find that the COVID funds went to all the different sectors that will boost the economy, not just the health sector. So that was what we were able to do as a National Assembly.
I was asking that question against the background of the fact that your intervention in that regard, what you allocated, the supplementary budget and the rest of them that was meant to address that issue were really, you know, appropriated, and they're appropriately, you know, in the best of ways. I was thinking you would give us an assessment, therefore, of how these monies were expended, talking about an assessment of the first phase of the vaccination.
Excellent. Thank you. You know, the National Assembly, apart from appropriating, the next thing is to oversight. And for quite some time now, this country, we don't just spend money anyhow. There are due processes that take place. And as the executive director has just said, the vaccines have started arriving, which means they have followed the due process. Very soon my committee will start going around again to oversight and check that all those things that they are supposed to have done with these funds are done appropriately, according to due process. We've started the oversight. By that time, they were in the processes of doing the due process. Most of the due process have completed. Some of the products have started arriving. So we'll go around again to ensure that all those things that were written in the budget that they are supposed to do with the funds are done correctly, and the amounts so stated are the ones that we have received. So that is part of the function of the National Assembly, and we are still on it.
All right, thank you indeed. We'll get back to you. Now, let's go to Director General of the National Agency for Food and Drugs Administration and Control, NAFDAC. Professor Adeye, many Nigerians, and indeed others across the globe, have expressed concern about the efficacy of the vaccines in circulation globally at the moment, and of course the possible adverse effect of these vaccines. I know that in different fora you have promised Nigerians that NAFDAC has taken measures to test out these vaccines and of course declare them fit, or safe, for people to take the jabs. Now let us know whether there are similarities or dissimilarities between these vaccines. And now we are having for the first time Moderna and of course Johnson & Johnson. We are already familiar with AstraZeneca, which most of us took at the initial stage.
Yes, thank you so much for having me again. NAFDAC is in a position to confidently declare any vaccine safe or unsafe. The AstraZeneca vaccine came in February, and before it came, we were working directly with the manufacturers. Although we've approved it, but after arrival, we had to sample the vaccine to ensure that whatever document we have in terms of quality and safety and efficacy, that we can confirm such once the vaccine arrives. And the first thing we do is to test the quality. So that is what we did for Covishield or AstraZeneca vaccine. It also came with a tracking and tracing barcoding. That vaccine came with tracing and tracking barcoding. And also we worked directly to get some of the data at the beginning from the company in India. And we were able to scan the barcoded secondary boxes or secondary packaging at the primary health cold store near the airport. And that gave us a template to work on in terms of following each box that primary health distributed to the local government to monitor the traveling of the COVID-19 vaccine, the Covishield. We were very, very successful. We use what is called the global location numbers. It's almost like the GPS that you have in your vehicle. So we assigned these global location numbers to about 440 facilities, primary health facilities across the country. We were able to cover 34 out of the 36 states. We also did FCT. And the reason for not covering the 2 states was because when the vaccine arrived, our own staff, NAFDAC pharmacovigilance staff at the state, there was lack of communication or bad communication between primary health and our own staff. But we've gotten over that now. And this is the first time in the history, well, it's a short history of COVID-19 pandemic, but this is the first time that this technology, traceability technology, will be used to monitor the distribution of a vaccine across any country in the world. However, Moderna came, we didn't know whether they have the barcoding and all the full electronic data on the packaging. But we then found out that it wasn't complete. So hurriedly, we have to think through. Because of what we did for Covishield, we said, okay, we will do what is called in-country serialization using the GS1 technology. And we started a back-breaking exercise. We met with primary health. You know, the vaccine distribution in Nigeria is a model for the world, actually, because primary health, UNICEF, Gavi, they've put a structure that makes vaccine distribution to be much easier. So we met with primary health that this is the case. This is what we have. We need to monitor these vaccines as they go, just like we did for Covishield. And, you know, it was a great meeting at the office of the primary health. And, you know, the collaboration between primary health and NAFDAC started around September last year. So we work very, very closely together. And that is why we have success in Nigeria. So we worked for about 5 days, almost nonstop. Our staff, NAFDAC staff, almost nonstop, doing the serialization and the scanning onto the boxes. And it was yesterday that I presented what we did in the country to the global traceability steering committee. And they were just praising Nigeria. And when we do good things in Nigeria, we've got to say it. like the structure of vaccine distribution in Nigeria, the traceability. NAFDAC is the only country in the world that is doing this. Why? So that we will know that there is no falsified vaccine that comes into the supply chain, so that the safety can be assured that it is the same vaccine that left primary health facility that somebody in the remotest local government will be getting. So it has been a great experience for us in the country. And of course, the National Assembly has been wonderful. This 9th Assembly has been wonderful in terms of supporting COVID-19 pandemic in general. And I would want to thank Honorable Michelia for being a great leader, and of course, the Speaker of the House, because they've supported us. NAFDAC is extremely grateful because if we don't have the wherewithal to do the testing, there will not be any vaccine to use, because we will not release any vaccine that we know is not tested, that we know that it may not be safe. So it has been a great year for us. The National Assembly has been so supportive, and this is just the beginning, because National Assembly is not just supportive of what we are getting now. They are looking forward to the future in terms of local manufacturing. And I'm going to stop there because the discussion may also go to that angle. Thank you so much.
Yes, we're still staying with you for a while. I'm glad that you've told Nigerians that NAFDAC has the wherewithal to test any kind of vaccine to determine its safety level. We thank God for that. But I want to ask you this. Now, we're now talking about a variant of the virus, which is the Delta variant, which is more aggressive and more dangerous. From the result of your testing of the different vaccines that we are using in this country, would you say that in a particular vaccine could address the Delta variant more than others? Is there any differentiation, in terms of the efficacy of these vaccines with respect to addressing the latest variant, now Delta variant?
Actually, it is data that will be coming out as days go by that will determine that. However, what has been reported in the literature is that AstraZeneca that we have, Moderna now that we have, are effective against the variants. Many people that are dying now in most countries are those that were not vaccinated before the variants were detected and after the variants were detected. The data after the variants were detected are still being compiled. But the bottom line is that what we know now is that those who do not get vaccinated are the ones dying. And that is why it is extremely important for everybody in Nigeria to take the vaccine. It is an opportunity to live. And if you have an opportunity to want to beat death, then this is it. But in terms of which one is better than the other, at this point in time, we know that Moderna that we're getting now and the AstraZeneca, they are working in terms of people not getting badly affected or ill to the point of death. So that's what we have right now. Science is the one that we are following. Thank you.
Okay, thank you, Professor. Let's now turn to, Dr. Faisal Shaibu, and then hear his views about the first phase. As we go into the second phase, 2.45 million Nigerians have taken the first jab, and there are about maybe 1.4 thereabout have taken the second jab. And then we are going into the second phase of the rollout of the vaccination plan. Out of your experience in the first phase, or against the background of your experience in the first phase, tell us how the second phase is going to look like, and what did you really choose? What were the challenges in the first one that could now make you sit up and then the second one better with the amount of doses you have on the ground, which is almost the same with the first one? You have 4 million and 4 million plus now, almost 5 million.
Right. Yeah, so The second phase has different elements that we've included as part of our strategic plan to make sure that we get to more Nigerians than we did in the first phase. One of the biggest challenges that we faced in the first phase was that of vaccine hesitancy, right? And this is something that is globally common, right? There are people who have different concerns around taking vaccines. In the second phase, we've done a great job of engaging through the media, through the partnership that we have with the press, to provide the correct information to Nigerians about the safety and effectiveness of these vaccines. We've been very transparent about the fact that if you take vaccines, they come with some side effects, right? What is important is that these side effects are well documented and provided to the manufacturers, so that the manufacturers are also aware of how they can improve these products. But apart from making sure that we are prepared for this phase, making sure that we have adequate cold chain, we've also considered the fact that it's very likely that COVID-19 is going to be with us for a very long time, right? It's not going to be a sprint. This is a marathon. Another 2 to 3 years, we're going to be with COVID-19. So we have to also be mindful of the fact that there are other diseases in the community that also threaten the livelihood of individuals. So what we're doing now is using a whole of family approach, integrating COVID-19 vaccination with other primary healthcare services. So if an individual comes to the health facility, not only is he going to get the COVID-19 shot, but he will also get an opportunity to be screened for non-communicable diseases. So adults are going around not knowing that they're hypertensive, not knowing that they're diabetic. So we're using this opportunity to also do all of those testings, right? And then if people come out with, the signs of diabetes or hypertension, for example, then they are referred. We're also looking at malnutrition, because there's a high prevalence of malnutrition in some of the states. So we're looking at kids that are maybe malnourished, but we're also using the opportunity to catch up on routine immunization for those that are under 1 year old. So with all of this package, we believe that it will encourage Nigerians to come to the health facilities, and then they will get additional access to these vaccines. One thing that we've also seen is that we're presenting the evidence.
Before you move on, are
Yes.
these tests free?
Absolutely. We're going to be doing the screening for these conditions free of charge, right? We're using the platform of this COVID-19. So we're not only focusing on COVID-19 and the vaccination, we're also focusing on those things that Nigerians are really, really concerned about. Because when you talk to Nigerians, they say, well, we have people dying from malaria, more people dying from diarrheal diseases. Why are we focused on COVID-19? Yes. We know that COVID-19 is very dangerous. If you catch COVID-19, if you're not, immune, if you have not been vaccinated, there's a high likelihood that you may suffer, permanent disabilities or even death. Unlike maybe malaria, where you have some level of immunity. But apart from that, we're also listening, just like we did with the polio eradication program, that people want more than just vaccinations. So this is why we're using the opportunity of the second phase to also increase information, making sure that people understand why they need to take COVID-19, but also for them to understand why they need to be screened against non-communicable diseases. We know that one of the biggest challenges that we have to overcome with the second phase is vaccine hesitancy. Yeah. This is why we're presenting the evidence. First, there were Nigerians that said, oh, we don't like the mRNA vaccines, we prefer the other one, or the protein vaccines. So we brought AstraZeneca. And they say, oh, but the AstraZeneca is not as good as the mRNA vaccines. So say, okay, now we have Moderna vaccines. What else do you want? They say, oh, they wanted NAFDAC to certify them. NAFDAC has certified. Then they say, then maybe, how are you sure that we're going to get the vaccines all the way to the communities? We have done that. Check, 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 check. Now the evidence is out there in the open. Those who are hesitating, those that have absorbed concerns, now need to look at the evidence. And I believe Nigerians will take the most rational decision and come out en masse to get the vaccinations.
Yes, when you're talking about the different vaccines, in circulation and what some Nigerians are saying, some are also saying that, look, why do I have to take two jabs? Why not one? And of course, we now have Johnson & Johnson, which is one jab. All right, now, Dr. Michelia, with respect to the issue of vaccine hesitancy, I believe that representatives of different constituencies in the country will have a role to play in this direction, because invariably we are having those hesitancy from the rural areas. In fact, in many rural areas in Nigeria, they don't even believe that COVID-19 exists. When you travel to the village and you're wearing face mask, they look at you as, in fact, they will even say, like, look, you are the person that has COVID. Yeah. So what are your members, thinking in this direction? Again, sensitization and ensuring that your constituents, avail themselves of the opportunity to get vaccinated.
Thank you. In fact, when the Committee on COVID-19 was set up, one of the key areas we were asked to look at is to be able to act as a liaison between the PTF and the community. And what we did as a committee, we even organized training for the members themselves, so that when they go home to their constituencies, they will be able to talk to their constituents and enlighten them and tell them exactly about how to use these non-pharmaceutical measures like wearing masks, hand hygiene, not going into crowded places, physical distancing, and the rest. And that training was done successfully. Most of our members went to their constituency. I remember in my own constituency, I not only just printed flyers to explain these basic procedures to protect themselves against COVID, but we were able to procure some of these measures and give our constituents. And we provided also, hand sanitizing equipment and so on, and placed in all health facilities along with the flyers that I've just mentioned. Now, honestly, if you look at it, even during the first phase, which is the one that is the most difficult, people came up and got vaccinated. And in fact, we ran out of the vaccines before we were able to get the second supply, which is a clear indication that the uptake was not a problem. People are coming forward and accessing the vaccines. And the good news is that, just like Professor Adeye said, all the vaccines that we're expecting or that are already around are effective against the new variant. So people should not be afraid. And the third phase is there. We've seen the spike. Just before the third phase, at a point, I think we were almost going to double figures all over the country. But now the spikes have come. People should be serious about it. They should practice these non-pharmaceutical measures. Even if you are fully vaccinated, it does not stop you from catching the virus, but you will not develop the disease if you are fully vaccinated. But if you catch the virus and you are fully vaccinated and you will not develop the disease, you can still spread it to loved ones. You have elderly relations at home, you have people with other medical conditions that can make the disease serious in your community. And even though you are not going to develop the disease, you can infect those people that you associate with. So we are urging Nigerians to still practice the non-pharmaceutical measures, even if you are fully vaccinated. And they should come out in mass, just like the executive director said, to access these vaccines that are now available. They have state-of-the-art logistic in place to take these vaccines to the nook and crannies of this country.
What really bothers me, Nedabo, about this vaccination, Dr. Maybe you can just come in here, is the fact that when one is vaccinated, and if eventually the person is exposed to COVID-19, maybe he had infection, why would the person now be able to transmit the same disease to some other person after having been vaccinated? So I'm just wondering, because of the efficacious level of these vaccines, if you are vaccinated, yet you can transmit the disease, I don't know, why should that be?
So it's got to do with the mechanisms with which the virus acts, right? So different vaccines have different capability in reducing transmission. Absolutely. And one thing that we're beginning to gather data on is the level at which this transmission continues, right? We do know that there's breakthrough transmission infections that occur. We don't completely know, about how this happens and why it does. This is why science, is dynamic, and we don't say categorically that this is why something happens unless we have the information. One thing that we do know, one thing that the data shows, is that once you take the vaccine, you are protected from severe disease, hospitalization, and death. And what the data also shows is that if you've taken the vaccine, you are protected in such a way that even if you're going to be sick, the illness is going to be mild. You may be able to transmit the virus, but even that data is not completely formed. So as we continue to get experience with the vaccine, then we'll be able to know how this really happens, what is the mechanism, and then the manufacturers of the vaccine will now be able to tweak the vaccine to make sure that not only does it prevent mild disease, that it also is able to prevent transmission. So, it's a new vaccine. We're getting more information about how it works.
Can I come in there?
Please.
You see, when you are vaccinated, it means you are given something that is like the virus, and your body identifies it and builds defense against it. So when you catch the disease, a disease that can stay with you for the next 2-3 weeks, and during that period you'll be transmitting it. For somebody who is vaccinated, it won't take more than a few days. Your body will get rid of it. But within those few days, people that come into contact with you can catch it. It's as simple as that. You will not develop the disease because your body will fight it off. But during the period of your fighting off, you have the virus. And vulnerable people close to you can get infected. For somebody who's not immunized, he can be transmitting the disease for the next 2-3 weeks. But for somebody who is fully immunized, maybe a few days while the body fights it off, and then he will not be infectious again. But those critical few days that he's trying to fight it off, he can infect a vulnerable person next to him.
It is still in line with, the thinking of Nigerians and generally human beings about these kind of novel diseases and drugs. Let's move over to Professor Mojishola and then build on what Dr. Michelia and Dr. Faisal Shaibu said, talking about public reaction to these drugs and looking at the efforts you've made in trying to convince, or rather ascertain in the first place, the efficacy and effectiveness of these drugs through, something you called tracing and then tracking, barcoding. And of course, the in-country serialization you talked about for Moderna, sorry. You didn't talk about Johnson & Johnson, which is more or less like, much more friendly to people in the rural areas and almost everybody else, talking about its one jab, characteristics. Talk to us about Johnson & Johnson, and then what really happened about it and how did it go with NAFDAC?
Thank you so much again. NAFDAC has approved 6 vaccines up to date, and Johnson & Johnson is one of them. Any vaccine dossier that we get, we give it a thorough review by a multidisciplinary committee of NAFDAC, and they send the report to me. The committee sends the report to me, and then I pour over it, and I'm talking of line by line, to be sure that what was submitted, what we got, the dossier, what was submitted through the dossier, and what our own group, our committee, reported is scientific, and it has highlighted what we will need to look forward to after the delivery through primary health. One of the things that we look at
seems to have each there. But let's come back to the studio and then hear from Dr. Faisal Shaibu. If I got it right, the PSC said about 4,000, state-level coordinators have been, enlisted or enrolled for this second phase.
40,000.
40,000, really. Sorry about that. 40,000. Now, and we also look at the issue of storage, cold chain, and things to go along with that in order to have it, successfully rolled out in this second phase this time around. Talk to us more about this, and how are the states responding to these efforts by the PSC and, of course, all other agencies at the national level of COVID-19? How are states responding?
So one thing that we've done with this vaccination rollout is we've been strategic enough to understand that we cannot plan, from the national level. So right from the planning stage, we've had involvement of the subnational level. So we've had the states also sort of provide context and give feedback, around some of the strategies that we've developed together. So there's a lot of knowledge at the state level. There's a lot of excitement about how we can now implement. And because there's been a lot of investment in cold chain equipment in the last couple of years, we now have a situation where we have cold chain equipment in every single ward, right? In every ward, we have one primary healthcare center that is designated a functional primary healthcare center. And we're in the process of finalizing the installation of cold chain equipment in these primary healthcare centers. We hope that by the end of this year, we should be able to finish that. So because we have those cold chain equipment in those locations, the vaccines can get to those locations and be kept at the requisite temperature of +2 to +8 degrees Celsius. This is the temperature that we require our AstraZeneca vaccines to be kept. And even for the Moderna, we can actually keep these vaccines for the period of 30 days within that temperature. So the investments that the federal government has made in the last few years, making sure that those cold chain equipment are in those health facilities is now paying off. This is why the states are very confident that they're going to roll out this vaccination program and they'll be able to reach Nigerians with potent vaccines.
All right, thank you. DG NAFDAC, we understand that you're now back. We lost your signal a short while ago. You may have to continue from where you stopped, but add this to what you are trying to explain. You have the capacity to analyze the vaccines that are being administered on Nigerians at the moment. And one way will also be thinking the direction of the possibility of Nigeria looking inwards as well to develop our own local vaccine. Because if you can analyze the content or perhaps the whatever are the nutrients or the enzymes or chemical, whatever you call it, that are into those vaccines, it means that we can as well get around it locally here. Is that a possibility that Nigeria can one day say, look, that we can afford to make our own vaccine, not just for COVID-19, but for other diseases?
Thank you so much. Yes, like I was saying, we look at the safety of these vaccines once we get the dossier, and we note what may be peculiar to us as a population. So what our own pharmacovigilance directorate does is safety monitoring. And we do this again in collaboration with primary health. We have what is called the Med Safety app. We usually advertise this on NTA every week, unless we have another news like poisoning that we've just had in Kano and Sokoto. But every time we advertise on about the Med Safety app. It is an app that can be downloaded. You can self-report if you have a slight fever after or soreness at the site of injection, things like that. So that is part of our preparation. But in terms of looking forward, which I acknowledge the 9th Assembly for, Nigeria is in the best position in terms of local manufacturing. WHO is the body that determines which country are ready for local manufacturing. And the first entity they look at is the regulatory agency, which is NAFDAC in our case. They want to make sure that all the regulatory functions that will make the manufacturing, the distribution, the safety monitoring of any vaccine, that those regulatory functions are well established in the regulatory agency in NAFDAC. And we have been on this auditing pathway for about 3.5 years now. We started with over 250 recommendations that we needed to meet. And we've been working day and night to get to that maturity level. The goal is to get to a maturity level at least 3 in order for Nigeria to be able to manufacture our own vaccine. We were happy to let everybody know that WHO came in July and they were with us for a week to look at all these recommendations that they wanted us to meet. And we have only about 22 recommendations left. And some of them have something to do with our regulations that needed to be gazetted. As we speak, those regulations are being gazetted in Lagos. It has gone through, it's a long process through our council, through the Ministry of Health, through the Ministry of Justice, and then to the printer. So we are Nigeria is at the best position. Secondly, in terms of regulatory, because we're going to get to the maturity level 3 before any company starts. And when we get to maturity level 3, of course, in parallel with preparations for manufacturing, we will work together with the manufacturing company in terms of good manufacturing practices. And this comes with the building. Even the building has to be certified to meet international standards. And so that is part of what we're going to be doing. However, the Ministry of Health, the minister is very big on this in terms of local manufacturing. And we've been working for weeks, actually for months, not for weeks, to focus on a particular company that can manufacture vaccine. Nigeria has a stake in a company, BioVaccine. They have a 49% stake in that vaccine, in that company, and that is the company we are looking at now to present to the global community in terms of supporting Nigeria to manufacture our own vaccine. So to answer your question, yes, we're going to be manufacturing vaccines for COVID-19 pandemic. However, it's not just COVID-19 disease. It is for routine vaccines. In fact, that was what was in the works before. That was what was being planned before COVID-19 pandemic came. So the government is very, very supportive of this effort. Again, 9th Assembly, they voted some amount for the company that will be manufacturing for us. And we're going to start with fill and finish, meaning the material, the active ingredients, the components of the vaccine will be shipped to us in Nigeria to this particular company. NAFDAC doesn't do manufacturing, we just do the regulation, to the particular company, and then they do the fill and finish for our own people here. But for routine vaccinations, yes, it is the same company that will be handling this. So the government is very big on this. CBN is very big on making sure that technology or science behind the development of vaccine is well noted. So Nigeria is in the best position to manufacture vaccine. Right. Over. Thank you so much.
Looking forward to that and the nearest future, really. And I will really have to add that if it's going to be, let it be with the malaria one for a start.
Yeah, we're actually going to get malaria vaccines pretty soon.
Yeah, that's great, therefore. Dr. Faisal, about 2 million Nigerians have taken the first dose. Over 1 million also have taken the second dose. And here we are in the second phase 2 of this vaccination rollout. Johnson & Johnson is only 1 dose. And there are 3 vaccines there. And it's all over the place. Now, talk to us about how to go by this. I have not really, maybe for instance, been vaccinated, even for the first jab. Some Nigerians are like that, for instance. And then they come across maybe Johnson & Johnson or AstraZeneca or whatever. What do they do? Where do they go to? For those who have taken one dose, how do they really approach the issue? What about those who haven't?
So we're very clear about the fact that these vaccines are essentially, the same in terms of the ability to protect anybody from severe disease, hospitalization, and death, right? But the one thing that is special with the Johnson & Johnson is the fact that it is a single-shot vaccine. So what it means is that you take one jab and that's it. Mm-hmm. So with the few doses that we received a few days ago, about 177,600 doses, we're going to be focusing on those areas where we want to be able to efficiently give one dose and that's it. So we're focusing on how to reach areas, security compromised areas, right? So places in the northeast, places where we feel that we may not get a second opportunity to give that jab. And then places like riverine areas where people live far out, right, on the bodies of water. So that is the single instance where we're saying there's a preference of one vaccine over others. But for the Moderna and the AstraZeneca, it's people have the choice to take whichever. However, there are about 1.1 million Nigerians that took the first dose of the AstraZeneca. And now that we've gotten additional doses, additional supply of the AstraZeneca vaccine, they need to follow it up with a second dose of AstraZeneca. They can't be trying to get the Moderna now, and mixing them up, right? And we're making arrangements as well to roll out at the same time the Moderna and the AstraZeneca vaccine. So first, people will be able to get their second doses, complete their vaccination, become fully protected, and then we'll get additional doses of the AstraZeneca where people can now start all over and take first and then second doses.
All right. Because I was one of those who have taken AstraZeneca, the 2 shots, and some were asking just about, like another asked, whether one could take one shot of AstraZeneca and then another shot of Moderna. And one also is questioning science in this direction as to look, why 2 doses for one vaccine? Johnson & Johnson, I think, should be rated number 1 in this because it's just one shot. Well, that's just by the way. Gentlemen and lady, we are concluding this segment of the program. I wish we had time, to talk more on this because there are other issues that could be discussed with respect to this particular conversation. So let's appreciate you once more, the Executive Director and Chief Executive Officer, National Primary Healthcare Development Agency, Dr. Faisal Shuaib. Thank you indeed for coming on the program.
Thank you for having me.
All right, Dr. Haruna Michelia, Chairman, House Committee on COVID-19, former Commissioner of Health in Borno State and consultant to the University of Maiduguri Teaching Hospital. It's been wonderful sharing your thoughts on this program.
It's my pleasure. Thank you.
All right, and the Director General, National Agency for Food and Drugs Administration and Control, NAFDAC, Professor Mojisola Adeyeye. We also appreciate you for contributing to this conversation. Thank you, Madam, for reaching us via Zoom.
Thank you so much for having us. Thank you.
All right. You are Good Morning Nigeria, broadcast live on the network service of the NTA. We take a short break now. When we return, we shall be focusing our attention on the second conversation slated for this morning. Don't go away. All right. Our second conversation is on antibody and the PCR, the third wave of COVID-19 and the Delta variant. We are currently a global health concern, and the issue of testing is being given attention across board. There are different types of tests for the COVID-19 virus.
And of course, joining us to speak more on this in Abuja is the Director, Medical Laboratory Services, Nizamiya Hospital, Abuja, Usman Habu Balbaya. Welcome to the program.
Thank you, sir. Good morning, Nigerians.
Thank you very much. We have a very limited time really to discuss this second segment and this second topic. Let's hear from you directly. We're talking about antibodies, we're talking about PCR, we're talking about COVID-19, and most importantly, the Delta variant. tell us. Antibody testing. What exactly do you mean, and how do you really get through to that and then see what relation it has in trying to find one's status?
Yeah, antibody testing generally is a simple test, actually, that gives a numerical value and measures the antibody levels against the COVID-19 virus. Antibodies can be achieved primarily maybe in two ways. Is it through vaccination or through natural exposure? When you get a natural exposure by the COVID-19 vaccine virus, your body tends to develop an antibody against the virus, and then you tend to have the antibodies in circulation in the body. And with respect to vaccination, it is primarily the main principle behind vaccination, to expose you to the virus so that the body stimulate antibody production, and then the antibodies will be in circulation, ready for possibility of reinfection.
Now you're talking about immunity here, it seems like, generally.
Yes, generally it's about immunity. So basically what you are trying to do is you are trying to find out whether you have had exposure or after vaccination, whether you have developed immunity against the virus or not. Because there is possibility that after vaccination and then natural exposure, you are still not immune to the virus. So basically that is what the antibody testing is all about.
Now, how do we know one's level of immunity? And could you just differentiate between immunity and antibody? Because I know that immunity has to do with one's ability, the body's ability, to generate a fighting force, against any virus or any other diseases. Now, what is it about antibody?
Yeah, the development of antibodies is what leads to immunity. When you get vaccinated, the antibodies are not in the vaccines. The antibodies are just the vaccines are just stimulating your immune system to develop antibodies against that particular virus. And when you are able to develop those antibodies and they are in circulations in the body, that is when you can say you are immune to the particular virus.
There is this insinuation, since the vaccine on COVID-19 got into circulation. It's an insinuation, really, nobody is particularly sure about that, that in the next 2 years, those who have taken vaccination will have an issue with antibody, that antibody will eventually begin to fight the system, the body system, or the body chemistry, and of course it could lead to death.
No, this cannot be true, because antibodies are produced by your body. So they are more or less part of the body. Why they are produced is because they have sensed a foreign substance into the body, and they are meant to fight it. So I don't see possibility of them reverting to autoimmunity. I think that's the term we use medically. That is autoimmunity. Yes, something that is part of your body now reverting back to fight the body. Yes.
Okay, there are instances fully that persons who are fully vaccinated, especially against COVID-19, later tested positive for the virus again. And then one would think that once you've been vaccinated, you're supposed to be sort of protected to a certain level, all right, against the vaccine, but it falls back again. What's responsible for that?
Yeah, actually, this is what we call the breakthrough infection in the vaccination. People that have been vaccinated, or they perceive to be vaccinated, let me put it that way. And when we say fully vaccinated, we mean you have taken the first and the second dose for a category of vaccines that have 2 doses. That is fully vaccinated. And then you get a reinfection with the vaccine. It could be due to different reasons. One, I can say technical reasons. Technical reasons, these vaccines are fragile. They have a mode of storage. If the storage is altered and is not maintained, that is the cold chain, it could lose some viability or potency, and it may not act effectively in the system. It could be due to maybe a healthcare worker factor, maybe during the administration of the vaccine. Maybe it was wrongly administered. by the healthcare worker, or it was not adequately administered. Maybe if it is, you have to give 1 meal of the vaccine for a dose, and it's end up giving maybe half a meal or a quarter a meal. So the vaccine will not elicit the desired response in the system. It could also be due to a new variant of the virus, yes. Most especially now we are in the third wave and we are dealing with the Delta virus, which is actually more deadly, more virulent, and highly transmissible type of the COVID-19 virus. So if there is a variant, there is possibility that you may get reinfected with this vaccine, with this, with this virus. But the only difference is that it may not have a significant effect. You may not come down with the disease. There is a high possibility that you may not be hospitalized or have a very serious symptoms because of the previous vaccination. And it could also be a host factor.
Okay. What do you mean host factor?
A host factor, which means me as a person that got the infection again, or got the vaccination in the first place. Maybe low immunity, which could be genetic, or maybe I'm on medications.
Other medications?
Or it's other medications like chemotherapy.
Okay.
That tends to lower the immune or weaken the immune system of the host. So these are some of the factors that may lead to a breakthrough infection.
Now, how does one get to know his level of immunity, and how is it possible for one to boost his or her immunity if, of course, the immunity has been brought low by whatever reasons? You know, as rightly pointed out, chemotherapy could do that. Is there any way whereby one can boost his immunity? And how do you even determine the level of immunity in your system?
To determine the level of immunity to COVID-19 virus, that's what brought us to the issue of antibody testing. You have to do the antibody testing. And when you do the antibody testing, then we'll get a numerical value, which will signify whether you are immune or you're not to the virus. This will give you so many information. It may mean the jab you have taken is not even a potent jab, because it has not elicited any response completely. So when you do the test, when you get the result, then you get to know whether you are immune or not to the virus.
Where can one get this? Sorry, where can one get this antibody
we run it in our facility. That is in Nigerian hospital, right here in the heart of Abuja. And it is a simple test. It just requires a blood sample, unlike the PCR testing for COVID, which people always complain of irritation and the rest. Is just a simple test. We just need the blood to run the investigations. And it takes less than 24 hours for the result to be ready.
You didn't talk about cost implication here.
It is not expensive. Right. It's just 24,000 naira.
Just 24,000.
Just 24,000 naira per test.
Okay. Since we're talking about immunity, sometimes I'm curious. There are other ways of trying to boost immunity. When you mention the cost, I know a lot of other people may not be able to really make it up in that regard, given the current prevailing economic situation. But all the same, a lot more can still do, because some still have that. There are ways of trying to boost immunity, which we've been told much earlier when the first phase of COVID-19, came in 2020. You take ginger, you take garlic, you take lemon, you take all these kind of things. This boosts your immunity.
Yes,
and now,
and what have you?
Right now, I know you're not a nutritionist, but all the same in the circle, talk to us about how one can boost his immunity as much as possible if he is unable to really make up the 24,000 naira or get the antibody test.
Well, like you said, you can boost your immunity in so many ways. Yeah, I understand. You can go on dieting. The nutritionist can get it right. Maybe fruits. You go by fruits. Other ways of boosting the immunity is physical activities. You engage in physical activities. You eat healthy diets. These are all measures to boost the immunity. Medically, some doctors prescribe vitamin D tablets and other vitamins that are also plays a vital role in boosting a person's immunity.
All right. let's also talk about this variant, the COVID-19 variant, which is, of course, ravaging the world at the moment. Some also saying that there could be more variants after the Delta variant that could even be more deadly than what we have now. From what you have learned so far, Nigeria now has about 3 categories of vaccines, that are being administered at the moment: AstraZeneca, Moderna, and Johnson & Johnson. Johnson & Johnson, by the way, is just one jab. Is there any kind of a differentiation with respect to the efficacious level of these vaccines, the one you take on 2 occasions and the one you take just once?
Not really. Vaccines actually works on different principles. The first dose and then the second dose, like for AstraZeneca and I think Moderna, they have 2 doses. So it is the way they are being manufactured to function. So the first dose stimulates an immune response, and then the second dose augments it. But the manufacturers of Johnson & Johnson made their own in such a way that a single dose will be able to achieve what the first and second dose of other vaccines can be able to achieve. But the principle behind it all, or the target, is just stimulating an immune response. And I want to believe that it has passed through all the checks before it is being approved for that.
Now, science has not left us alone, I believe, given the fact that every now and then, developments come up, especially in relation to the COVID-19. There are so many ways of testing now, testing antibody and the PCR, and a lot more are being evolved and introduced every now and then. The one done in your own facility, how recent is it, and how, up to date, I must say, is it so much so that it's worth patronizing?
Yeah, actually, we established the COVID-19 PCR laboratory almost 3 months now. We established it quite late compared to other organizations. And this is due to the fact that we were having so much request from our clients that have been using the hospital. And then there is so much pressure from other international organizations that see our hospital as a yardstick of quality when it comes to healthcare in Nigeria, and especially in Abuja. So we now decided, okay, and also because of the rising cases of fake results as of that time. There was a rising case of fake result, and then we spoke with the minister, and we now established that unit. And the Minister of Health himself actually opened up the unit, commissioned it himself, and we became a yardstick of quality for other centers to emulate based on what he saw on ground, from the setup and then the equipment, including the trainings and everything. And in Nigerian Hospital, we are using the Quan Studio 6 Flex, which is a Thermo Fisher product for our PCR testing. I think it is now that some organizations or some institutions are thinking towards that line, because when we sat down to establish the place, the hospital was like, okay, what is the best and the most modern and recent diagnostic method we can get so that we give a reproducible result at any time. And this is exactly what we have done.
Now, government has been carrying out these tests of COVID-19 free of charge. And now that a private hospital, you have, as you said, ultra-modern facility for this testing. What does it cost to do that? I hope it's not on the high side, so that Nigerians can also use the...
Yeah, I think there's baseline for the testing, both in our hospital and in other places. Almost 90 to 95% of institutions that run this PCR testing, they run it at 39,500, which the government said this is the baseline. It cannot go above that. Even though we give a better quality, we now decide to still maintain that baseline so that people can be able to afford it.
Do you test all your, for instance, you have a patient, that comes in with cough and what have you. Do you subject the person to COVID-19 test before you even address any other disease that may be disturbing the person?
Yes, of course. There's what we call infection prevention. So when the patient comes, we have a screening center in the hospital. You first of all have to pass through the screening center in the hospital, and then you'll be clocked there by the doctor when you have the symptoms. Then the test is requested. Then if the patient is stable enough, he will just do the test and wait for the results before he is being attended. But if the patient is not that very stable, we now put the patient in an isolation center.
If the patient came in with complaint or symptoms of another ailment that's unconnected with COVID-19, but maybe have some other symptoms of COVID-19, will he or she have to pay for COVID-19 tests as well as the very ailment that brought the person to the hospital?
It has to be ruled out. COVID-19 symptoms have some similarities with other non-COVID-19 infections. For example, if you have a pneumonia, you have a cough, you have a fever, you understand. But at this stage, these are symptoms that mimics the COVID-19. So we have to rule out COVID-19 first before you will be attended to.
But there are instances where in certain facilities outside your own, as we all know, COVID-19 is an opportunistic disease that cashes on other, underlying ailments like high blood pressure, diabetes, and some of this, and even pneumonia, as you said. Some facilities, try to conduct these tests for these basic tests, for these diseases, and then that's in addition to the COVID-19 test. I don't know whether you do that in your own facility. I'm just looking at the cost implication of all this, because if you're going to go out alone, for these alone, you have to pay for them alone. But in other facilities, they run you through this test and then the COVID-19 test in order to know how to approach your case.
Yes, definitely you run other through investigations. We are not singling out only COVID-19. For example, you come with a complaint and you have some symptoms of COVID-19. And maybe on the system, you are already a registered patient. I have known that you are already diabetic or already hypertensive. You understand? So this, in this situation, we will request what is required for what we are expecting, and then add a COVID-19 screening test, part of it. If it comes negative, then we proceed with your ailment. And if it comes positive, then we now give treatment, coupled with other complaints that you have. But then there is going to be a kind of a restriction. We see you at the isolation center, the blood will be taken. You will not go around like other people, because those that doesn't have such symptoms. So that for fear of what? Of transmitting the disease, should in case COVID-19 is involved. So that is what we do. So in the isolation center, we take your sample, we take your blood sample, we take for the COVID test also. While the COVID test is running, other investigations are also running. By the time they are ready, then we proceed.
All right. Thank you so much, Director, Medical Laboratory Services, Zamia Hospital, Abuja, Usman Habu Balbala. I hope I got that correctly. Balbaya.
Yes,
All right, we thank you indeed for your insight on this very topic. I hope that when either Nadabo or myself come to the hospital, you will slash your charge.
There is room for that. Actually.
All right, thank you indeed.
Yeah, you're welcome, sir.
This is Good Morning Nigeria. We now take foreign news.
The Taliban's top political leaders have landed back in Afghanistan from Qatar, where many were in exile. Taliban militants have also given their first press conference 2 days after completing their takeover of Afghanistan. They maintain that women will enjoy rights according to Islamic law. They also insisted that the country will not be used as a base for foreign fighters to spread terrorism, and the Taliban will offer amnesty for all those who have worked for foreign powers. Local reports say while the streets of Kabul are quiet, militants are out in force, manning checkpoints across the city. Military flights evacuating diplomats and civilians have also restarted at Kabul's airport.
And up next on Good Morning Nigeria is sports.
Nigeria Super Eagles have been drawn in Group B with Egypt, Sudan, and Guinea-Bissau ahead of the 2021 Africa Cup of Nations in Cameroon. The draw was held in Yaoundé, Cameroon, and had in attendance CAF President Patrice Motsepe and some African football legends. The Super Eagles will open their campaign against Egypt on January 11 before they will face Sudan on January 15 in their second group game. They will then play their final group game against Guinea-Bissau on January 19. Host Cameroon are in Group A with Burkina Faso, Ethiopia, and Cape Verde. The opening game of the 2014 tournament will be between Cameroon and Burkina Faso. The top two teams of each group, along with the best four third-placed teams, will advance to the round of 16. The tournament will run from 9th January to 6th February 2022. Meanwhile, striker Tammy Abraham has completed a €40 million move to Italian side Roma from Chelsea. Abraham, Chelsea's joint top scorer last season, joins the Serie A club managed by former Chelsea boss Jose Mourinho on a 5-year deal.
All right. And that's Good Morning Nigeria for today. We thank you for watching. Join us again tomorrow and we'll come your way with a fresh edition of the Good Morning Show. My name is Kirian Umayo. You have a great day.
And I'm Yusuf Nadabu. Thank you so very much for watching. See you tomorrow.